Todo 7. 7 healthy habits na go na go. Move more, eat right. Ang tamang pagkain at pagkilos ang pundasyon sa malusog na pamumuhay. Ngunit sa Pilipinas, marami pa rin ang hindi nakakakain ng tama at hindi sapat ang ehersisyo. 2 sa 10 bata na wala pang 5 taong gulang ay kulang sa timbang, habang 1 sa 10 bata naman ang sobra sa timbang at obese. Sa tamang diet at ehersisyo, maiiwasan natin ang lumalalang banta ng malnutrisyon at obesity. Maiiwasan din natin ang mga non-communicable diseases tulad ng diabetes, sakit sa puso at stroke. Para tayo'y manatiling malusog sa anumang edad, sundin ang mga tips na to. Gumalaw ng 30 to 60 minutes kada araw. Tangkilikin ang active transport tulad ng pagbibisikleta at paglalakad. O gumawa ng mga aktibong gawain tulad ng paglilinis ng bahay. Kumain ng healthy at iwasan ang mga pagkaing mataas sa asukal, asin at taba. Ugaliin ang pagbasa at pagsuri ng mga food labels. Iwasan ang mga inuming mataas sa asukal tulad ng soft drinks at uminom ng di bababa sa 8 baso ng tubig kada araw. Pag naghahanap ka ng panghimagas, kumain ng prutas sa halip ng mga minatamis tulad ng cake at ice cream. Tara na't labanan ang malnutrisyon at mga sakit. Ugaliin nating mag-move more, eat right, for a healthy Pilipinas. Todo 7. 7 healthy habits na go na go. Be clean, live sustainably. Ang kalusugan natin nakaugnay sa kalinisan ng ating kapaligiran. Kasama rito ang malinis na hangin, ligtas at malinis na tubig para sa lahat. Wastong pagtatapon ng basura at iba pa. Ang hindi wastong pangangalaga ng kapaligiran ay nagpapalala o nagiging dahilan din ng climate change. Lagpas 5 milyong Pilipino ang naaapektuhan nito. Umaabot sa 20 bagyo ang dumadaan sa Pilipinas kada taon. Apektado ang tirahan at kabuhayan ng mga tao. Dulot din ito ang pag-apaw ng mga ilog na nagiging sanhi ng matinding pagbaha. Ang dala nitong maruming tubig baha at iba pang pinsala ay nagiging sanhi ng mga sakit, impeksyon at kamatayan. Kaya sama-sama nating pangalagaan ang ating kapaligiran para iwas sakit at mapanatiling malusog ang katawan. Sundan natin ang mga tips na to. Maglakad o magbisikleta para maiwasan ang paggamit ng mga sasakyang nagbubuga ng usok na nagpaparumi sa hangin at kapaligiran. Bawasan din ang pagkonsumo at pagbili ng mga bagong bagay, lalo kung hindi naman kinakailangan. Reduce, reuse, recycle. Hindi natin maiiwasan ang mga kalamidad, pero kaya itong paghandaan bago pa ito dumating. Magtanim ng mga puno para mabawasan ang pagbaha at gumawa ng survival go bags. Let's be clean, live sustainably. Todo ang kalusugan kapag malinis ang kapaligiran. Todo 7. 7 healthy habits na go na go. Care for yourself, care for others. Alam mo ba na 1 in 5 Filipinos ay may mental health problems? Ito ay ang ikatlong pangkaraniwang health condition sa bansa, lalo na sa kabataan. Ang depression ay isa sa maraming uri ng mental health disorder. At ang Pilipinas ang may pinakamaraming kaso ng depression sa Southeast Asia. Ang mental health kasing importante rin ng physical health. Para maingatan ang mental health mo at ng iyong mga minamahal sa buhay, gawin ang mga sumusunod. Mag-exercise o tumutok sa mga hobbies. Nakakabawas ito ng stress at pwede ka pang humubog ng mga bagong skills. Mag-breathing exercises, tulong pangpakalma. Breathe in for 4 seconds. Hold breath for 7 seconds. And exhale for 8 seconds. Gawin ito 4 times, twice a day. makipag-connect sa iyong pamilya at mga kaibigan. Ipadama ang iyong pagmamahal sa regular na pakikipag-usap, pag-text o pag-video call sa kanila. Care for yourself, care for others. Pangalagaan ang isa't isa para sa malusog na kaisipan. Todo 7. 7 healthy habits na go na go. Don't smoke, lessen alcohol, say no to drugs. Ang pag-abuso sa alak, yosi at droga ay di lang delikado sa kalusugan ng gumagamit. Nakakaapekto rin ito sa kalusugan at kaligtasan ng iba. Ang problemang ito ay laganap sa Pilipinas at sa buong mundo. Kaya alagaan natin ang kapakanan ng bawat Pilipino para supuin ang adiksyon sa alak, yosi at droga. Gawin ang mga sumusunod. Tigilan at huwag simulan ang paninigarilyo. Lahat ng uri nito ay nakakasama sa kalusugan. Ang paninigarilyo ay sanhi ng mga sakit sa puso at baga. Kahit hindi ka alcoholic, drink moderately. Huwag lumagpas sa 4 na baso ng inuming nakakalasing anuman ang okasyon. Ang sobrang pag-inom ng alak ay masama para sa iyong kalusugan. Kilalanin ang adiksyon bilang isang problema sa kalusugan na maaaring matugunan sa medikal na pamamaraan. Pumunta sa mga drug rehabilitation facilities ng DOH o pamahalaang lokal kung ikaw o ang iyong kakilala ay nangangailangan ng tulong. Tara na! Suportahan ang ating kapwa na magtagumpay laban sa adiksyon. Don't smoke, lessen alcohol, say no to drugs. Tawagan ang Substance Abuse Helpline o Quitline sa mga numbers na ito. Todo 7. 7 healthy habits na go na go. Do no harm, but safety first. Taon-taon, umaabot sa 12,000 Pilipino ang namamatay dahil sa mga aksidente sa kalsada. Noong 2019 naman, kada 13 minuto, may isang Pilipino na pinapatay, pinagsasamantalahan, ninanakawan o nagiging biktima ng karahasan. Ang karahasan at kapahamakan nagiging sanhi ng mga problema sa physical and mental health at problemang pinansyal. Pwede rin itong humantong sa kamatayan. Pero maaaring iwasan ang mga problemang ito sa tamang paghahanda. Para laging ligtas, tandaan ang mga tips na to. Gawing ligtas ang ating mga kalsada. I-report sa tamang otoridad kung may mga sagabal o sira sa daan. Mag-ingat sa pagmamaneho. Para sa mga nagmomotorsiklo at nagbibisikleta, huwag kalimutan ang pagsusuot ng helmet tuwing babiyahe. Huwag magmaneho kung ikaw ay walang lisensya, inaantok o nasa impluwensya ng alak o droga. Mag-report ng kaso ng pananakit o pang-aabuso sa kinauukulan. Pumunta o tumawag sa Women and Children Protection Unit sa mga ospital ng DOH o sa PNP kung kailangan. Gumawa tayo ng ligtas na kapaligiran para sa lahat. Always do no harm. Put safety first for a healthy Pilipinas. Todo 7. 7 healthy habits na go na go. Practice safe sex. Ang sexual and reproductive rights ng bawat Pilipino ay dapat inaalam, nirerespeto at ipinaglalaban. Ngunit dahil sa iba't ibang balakid, maraming suliranin ang kailangan pang matugunan. Noong 2017, 70% ng lahat ng mga babaeng edad 15 hanggang 17 ay maagang nabuntis. Panahon na para itaguyod ang sexual and reproductive health. Simulan na natin sa mga hakbang na ito. Pag-usapan ng sex sa iyong pamilya. Huwag mahiya. Sa tamang kaalaman, maiiwasan ang di planadong pagbubuntis at mga sexually transmitted infections. Di pa kayo ready magka-baby? Alamin ang iba't ibang contraceptive at family planning methods. Magtanong sa doktor o health worker tungkol sa pros and cons ng mga ito. Tigilan na ang stigma sa sex. Magtanong, makinig, makipag-usap at maging supportive. Let's practice safe sex for a healthy Pilipinas. Todo pito. 7 healthy habits na go na go. Get vaccinated. Noong 2017, isa sa bawat 5 batang Pilipino, edad 1 hanggang 2, ang di nabakunahan kontra tigdas at polio. Isa ito sa mga naging dahilan ng pagkalat ng tigdas at polio outbreak noong 2019. Kaya para sa kalusugan ng lahat, ugaliin nating magpabakuna. Protektahan natin ang mga bata at kabataan sa tulong ng pagbabakuna. Kayang-kayang iwasan ang mga sakit na nakamamatay o nagdudulot ng kapansanan. May bakuna rin ang mga nakatatanda. Kumonsulta sa inyong healthcare worker tungkol sa mga vaccines na nararapat para sa matatanda. Magpabakuna. Huwag matakot. Sa mahabang panahon, ang bakuna ay napatunayan ng ligtas at epektibo. Kaya let's get vaccinated for a healthy Pilipinas.
Kumusta naman ka karong pandemya higala? Nanginahanglan ka ba og kaistorya? Ayaw ka bala ka? Adunay we support service providers nga anda maminaw kanimo. Abri ang atong linya gikan alas 8 sa buntag hangtod alas 5 sa hapon. Lunes hangtod Biyernes gawas lamang sa holidays. I-text lang ang DSWD space we support space pangalan /kasarian/edad/rehiyon /mensahe or concern og isend kini sa 0918-912-2813 o tawag lamang sa numero nga 0963-569-1906 alang sa Smart 0945-344-9755 alang sa Globe. Pwede usab sa atong website wesupport.dswd.gov.ph o mag-send sa email nga wesupport.focrg@dswd.gov.ph. Makasiguro mo ang tanang impormasyon nga inyong ipaambit ikonsiderang konfidensyal o pribado.
We listen, we care, we support.
DSWD, katuwang ng mga kapuspala.
Good morning, Caraga region. My name is Shabit Almar, and I will be joining you in today's activity. It's a beautiful Wednesday morning. It's currently 9:30 on our clock. So for those who are working from home and taking a sip of their coffee, please do enjoy yourself. And for those who are on their way to work or already in their offices, join us with our mental health series day 2. Kahapon po, we've already started with the first day and we have discussed a very interesting and informative topic. So by the way, we are doing this because the month of October is the celebration for the mental health months. And since we are promoting a healthy Pilipinas, the DOH CHT Caraga initiated to have this live activity to have a discussion on very important topics regarding mental health. Ladies and gentlemen, welcome to the Mental Health Series Day 2, Advocating Care for All. And of course, we would like to invite all our live viewers here on Facebook to please like and share our live stream so that a lot of our audiences online can join us. And of course, feel free to join us later as well on our open discussion. It's very important to do this. It's just a very simple step, like and share lang. And of course, you will be able to spread awareness all around the region and even with your friends wherever they are globally, because we want, our goal is to for us to become champions for mental health. So if you care for yourself, it's also equally important that you care for others. So of course, we are going to say hi to our live viewers. We currently have 60 viewers on our Facebook Live. We'd like to acknowledge your friends from the GSIS Butuan branch office. We also have people watching from Cortez Central Elementary School. Hello. And we also have live viewers from DSWD Home for Girls. Also from Alviola Integrated Secondary School. Hi, thank you so much for joining us today. We also have friends from Oh, we actually have a lot of viewers from GSIS. Thank you so much. We also have friends from Pigdaulan Elementary School. Maraming salamat po. I know the day is just getting started, and which is why this is a very important and a very efficient time to actually watch our live streaming, because our heads are in good condition. We have all the energy to listen to the discussion that our experts are going to have. Yesterday, we have invited a speaker who discussed with us a very informative session, and today we are going to do the same with another speaker as well. So yesterday, recap lang po tayo, we actually discussed managing stress in the midst of toxic work environments. So we actually had a session on early detection of mental stress, and identifying emotional vampires at work. Nakafocus po tayo because the pandemic's not really easy. We have to adjust to drastic changes that happened to us over the past year. And of course, we also talked about tips on natural coping. Kasi if you are able to detect your mental stress at an early stage, you can actually have a chance to cope naturally. So that's what we talked about today. Now, our topic today is very interesting as well, equally interesting as the one we have discussed yesterday. We are going to talk about taking care of our mental health during the pandemic. But before that, before I call in our speaker for today, would like to let our live viewers know that we actually have a helpline, DOH Historieta helpline. We have this available 8 to 5 every day, Mondays to Fridays, except weekends, except holidays. We have two lines for that, Smart and Globe, 0908-615-8754, 0927230488. That's our DOH Historieta helpline. You can see that right on your screen right now. Again, it's available 8 to 5 every day, Mondays to Fridays, except of course on holidays and weekends. So if you need someone to talk to, if you have something to discuss, we have people who are very perfect to talk with you over the phone. So now let's proceed to the most important part of today's activity, and I know you're very eager to start the discussion already. We are going to discuss, again, as mentioned earlier, taking care of a mental health during the pandemic. As I've mentioned earlier, it's never easy. No one's having it easy during the pandemic. We all had to go through changes that we did that was shocking to us. I think that's shocking is an understatement. So now I'm going to introduce to you our expert in this field. He graduated BS Biology, major in genetics at the University of the Philippines, Los Baños. Doctor in Medicine at the Pamantasan ng Lungsod ng Maynila College of Medicine. He later on took up Masters in Public Management, major in Health System and Development at the Development Academy of the Philippines. He was awarded Valedictorian Residency Training Program during his time in the Medical Training Office of the National Center for Mental Health. He also received his diplomate of the Specialty Board of the Philippine Psychiatry on 2019 from the Philippine Psychiatric Association. Currently, he is a medical specialist 3 in the National Center for Mental Health and the head of the Community Based Capacity Building and Training Unit for 7 years. Ladies and gentlemen, I'm very excited to hear what he has to share with me. Speaker for the Day 2 for Mental Health series Advocating Care for All. Let us welcome Dr. Rodney Boncajes.
Good day and welcome to the webinar on taking care of our mental health during pandemic. My name is Dr. Rodney R. Boncajes. I'm a medical specialist 3. I'm a psychiatrist and the unit head of the Community-Based Mental Health and Capacity Building and Training Unit of the National Center for Mental Health. Our objectives for today are the following: to understand and appreciate the concept of mental wellness and mental illness, to learn how to cope or address mental health problems during the time of COVID-19 pandemic, and learn some practical skills in dealing with stress. To begin with, I will be presenting the survey done or conducted by the Social Weather Station last September 2020 entitled the National Mobile Phone Survey. It says that the stress brought about by COVID-19 crisis remains high at 86%. So this is true among the hungry household from 62 to 69% and 48 to 53% among the non-hungry household. Similarly, great stress prevails among the jobless and those with jobs alike. Incidentally, great stress is highest in the Visayas area. It cuts across education and rises across sex and age group. Now we discuss the relationship between stress and mental health. So contrary to the popular belief of many, everyone has mental health. So mental health is not limited to those individuals who has already the conditions, but in fact, mental health is for everyone. Because it is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively, and is able to make a contribution to the community. This is important because mental health is part of the overall well-being together with physical and social well-being. And health, therefore, is not merely the absence of a disease or infirmity. This is according to the World Health Organization. So there are 4 psychological dimensions of mental health as explained earlier. One is we are mentally healthy if we can realize our own potential. This is translated roughly to our self-image, meaning to say we are stable when it comes to our ability to understand our own strength, our own weaknesses, our own potentials, or our characteristics. Second is you can be mentally healthy if you can cope with the normal stresses of life, such as the daily traffic, the floods after the rain, or even the noise from the environment. So somehow this is translated into resiliency. Number 3, you can be mentally healthy if you can work productively and fruitfully. And this can be translated into your ability to navigate things at work or at school with breeze. So this is somehow related to productivity and creativity. And number 4, you can be mentally healthy if you can contribute to the community, meaning to say you are aware of your sense of purpose in this life. So mental disorders are collectively all diagnosable mental disorders, which are health conditions that are characterized by changes or alterations in thinking, mood, or behavior, or some combination thereof. These are usually associated with distress and or impaired functioning. So mental disorders comprise of a broad range of problems with different symptoms. There are many mental disorders existing at present. So some of them are schizophrenia, anxiety disorders, depressive disorders, and bipolar related disorders. However, there are many numerous other disorders that may not be as evident as I have mentioned. Mental health problem, on the other hand, can also affect the person's thinking, feeling, or social relationship, but not to the extent that significantly hampers functioning like that of a mental disorder. So usually, mental health problems or complaints and include the mental ill health that are temporarily experienced as a reaction to life stressors. They are less severe or shorter in duration as compared to mental disorders, but may develop into mental disorders if not treated or not given appropriate intervention time. The question is when it is okay not to be okay, and when it is not okay not to be okay. So as a psychiatrist, we always gauge the domains of functionality of an individual to determine whether the individual is experiencing a normal reaction in life or whether the individual is really having a mental health conditions or disorder already. So one is the intrapersonal or the ability to self-care. So this include the ability to gain proper nutrition or eat, sleep, bathe or clean himself or present himself, as well as relaxation and exercise. The second is the ability to relate to other people or the interpersonal relationship. So comparing the usual behavior of an individual, for example, being a friendly and an accommodating one, now becoming an irritable and quarrelsome individual, or an individual who is isolating himself or herself. This can be seen by other people or be felt by other people as a sudden or an increasing change in one's personality that can really also affect the relationship or the ability to be with other people. And then third is the work or school performance as a domain of functionality, wherein the red flags would be tardiness, absenteeism or presenteeism, inability to deliver during the target, or inability to submit requirements on time, being called for by the boss several times because of poor performances. So if any of these three domains of functionality is affected, therefore an individual is warranted to be seen or evaluated by a mental health professional for a possible. Mental wellness and mental illness exist in a spectrum in such a way that not all the time we are mentally healthy or we are really well. There will be times that we will be experiencing some difficulties that can really affect our mental condition. So we have this spectrum. So going to the right is going into wellness, and on to the left is the illness. So you can be an excellent mental health condition if you remain to be cheerful and joyful, you are solution focused, you are energetic with high job performance, you prioritize your sleep and recovery, and you can observe that there is a flow or intense engagement in whatever you do. You fully realize your potential and you actively seek connection with other people. Now, if you are not 100% excellent when it comes to your mental health, you may be in the thriving spectrum, wherein you still experience normal mood with some variations of it. You remain positive and calm with functioning normally in the job. You can sleep well, remain to be focused, eating normally, and still have a normal social activity. You may be on the unsettled spectrum if you experience some worries or nervousness, being edgy or irritable at times, frustrated with self-doubt, or experiencing some sad and gloom days. You might be also experiencing or observing some difficulty in sleeping, feeling tired and distracted, and this may result all to decrease in social activity. Now, worse than this is the struggling part, wherein the individual is now becoming more anxious, depressed or sad, with low self-esteem, tired, resulting to poor work performance, presenteeism, poor concentration, inability to sleep or poor sleep, as well as appetite, and some individuals may resort to the use of drug or alcohol as a temporary means of dealing with their problems. Now, an individual is in crisis if he is now or she is now very anxious with very low mood, becoming now absent most of the time, rather than tired, becoming more exhausted, would complain of physical pains or becoming sick, becoming isolated, having poor sleep and weight loss, and sometimes psychotic break, and even severe drug use or alcohol abuse as a form of compensation to the situation. So, at this point, I would like to ask you to check your mental health, whether what or in what spectrum are you right now? Are you in an excellent mental health, in a thriving spectrum? Are you struggling or are you in crisis? So check mental health. Now, mental health is really related to stress, and stress is the experience that is similar to tension. It's the kind of feeling when you face a new situation, an unpleasant or a threatening circumstances. So it's the individual's internal reaction to the pressure or demand, and usually it is a state of physiological and psychological arousal as a response to a demand or change in our system or our environment. So there are many sources of stress. It could be personal stress or personal threats, family violence, illnesses or sickness, and even concerns in school. Stress can be stemming also from the work, such as having no work or having too much work, the culture in the workplace or the dynamic in the workplace, as well as the working environment. The community can also be a source of stress, especially in those individuals who are living in a place wherein there is a violence or displacement or a threat from the man-made or the natural calamities. And of course, finances is one of the major source of stress, as well as the uncertainty of the future, especially during this COVID-19 pandemic. People behave or people react to stress differently. So we have this signs of stress. We have this behavioral signs of stress, such as changes in energy levels and activities, increase in the use of substances such as alcohol, tobacco, or illegal drugs, increase in irritability with outbursts of anger and frequent arguments or arguing, difficulty relaxing or sleeping, crying frequently. Similarly, worrying excessively is a behavioral sign of stress. Wanting to be alone most of the time or isolating himself or herself, blaming other people for everything, having difficulty communicating or listening, having difficulty or accepting help, and even in the inability to feel pleasure or have fun. Stress can also manifest as physical signs such as having stomach aches or diarrhea, having headaches or other pains, losing appetite or the other way around, eating too much or stress eating, sweating or having chills, getting tremors or having muscle twitches, or even being easily startled. Stress can also create an impact to our cognition or our ability to think. So if you are having trouble remembering things, or you feel confused most of the time, or having trouble thinking clearly and concentrating, or making difficult or making decisions is difficult for you, you might be experiencing some cognitive signs of stress. And lastly, stress can also manifest as a change in emotion, such as being anxious or too fearful, feeling depressed, feeling guilty or angry, or the other way around, heroic, euphoric, or invulnerable, not caring about anything or becoming apathetic, or being overwhelmed by too many emotions. Stress is very common during this pandemic. So there are specific stressors that are particular to COVID-19 pandemic, and this include one, the rumors and misinformation from the social media. So we already have experienced difficult situations because of the uh, conflicting information from the social media. Second is the closure of school and children's activity spaces. So aside from us adults experiencing this situation, of course, the children are much affected by these limitations in movement and school activities. Travel restrictions, of course, we cannot go to places and see or visit our relatives. Possibility of actual physical isolation and quarantine. At one point or another, we might have been exposed to an individual who has been diagnosed with COVID-19. Thus, there is a risk of us being isolated as part of the contact tracing, or as has been identified during the contact tracing. Deterioration of trust in government agencies and social networks because of the persistent problem in the COVID-19 approach. Avoidance of health facilities, especially that majority of cases are now in the hospital. Thus, people would not want to go to the hospital despite the need of going there. The risk of relapse in pre-existing conditions, including mental health. This is because of the limitations in the services, as now those individuals who should have a monthly follow-up or a regular laboratory routine may not be able to do all of this because of the closure of the hospital or the limitations of the services in the hospital. And last is the common symptoms of other health problems which can lead to the fear or infection of having COVID-19. A simple cough or a simple fever might be misinterpreted as COVID-19 and might evoke a fear or anxiety to an individual or family members. So again, stress and COVID-19 pandemic are highly related. So if you are experiencing stress right now, you are not alone, because everyone is experiencing in one way or another some form of stress. So you might be looking back on how you have reacted to the stressful situation during this crisis. So one, you might be having panic and fear because of the unknown, or fear of falling ill, or getting sick, or even dying, or even losing livelihood. So at one point or another, you might feel anxious because of the uncertainty of the rapidly evolving situation. You might feel confused because of the too much information and conflicting information available in all forms. You might also have experienced some form of distress, especially when you have been isolated or grieving from losing loved ones who have died during this COVID-19. Some individuals may feel trust and doubt, or may react with trust and doubt on the efforts to control the spread of the virus, and a little portion of the population might have reactions such as stigma, especially against people or group associated with the potential spread of COVID-19. It is important for us to understand that during this time of pandemic, we are on the same ocean but not on the same boat. So the analogy is that all of us are experiencing the challenges brought about by COVID-19, which is similar to the ocean. All of us are traversing and navigating to these difficult situations or times. But not all of us are traveling at the same rate. Not all of us are reacting the same way. So this is our boat. So our boat depends on our past experiences, our own strengths and weaknesses, our coping mechanisms, our support system, and our ability to handle stress. Thus, we must always be aware that it is futile and invalidating to compare ourselves or to compare other people's experiences to our experience, as we have different reactions, situations, and resources, as well as coping mechanisms. Therefore, it is important for us to be kind and compassionate to everyone. How can we now manage our stressful situation? So, the Department of Health issued this 12S of stress management as early as 2007. And only during this COVID-19 crisis that this 12S of stress management has emerged as one of the popular themes in handling or navigating through these difficult times. So first is spirituality. So spirituality is a form of stress management wherein an individual would get in touch with the inner being that is connected to his or her belief. So praying, reading the Holy Scriptures, attending masses or church services, or even meditating can be helpful to some individuals. Spirituality reminds us that being human, we are limited on our capacity, and there are many things that are outside the bound of our abilities that can be dealt with by believing or by letting a supreme being do the rest of the tasks or do the rest of the things. So spirituality is also found to be one of the protective factors for mental health. Thus, it is important for us to consider spirituality as a form of stress management. Second is siesta or sleep. So we all know the fact that it is important for us to keep our brain and our body refreshed by having enough time of sleeping, especially during or after an day's work. Third is self-awareness. Self-awareness is our ability to identify how we are reacting to the stressful situation, what are the things that we do to manage our situation, and how can we improve ourselves in dealing with things that are usually bothering us. So self-awareness is a form of stress management because if you are aware of what is happening inside your mind or your body, you will have more understanding of how you will be able to manage your situation and become more compassionate and kinder to you and to other people. Number 4 is socials. So, as Filipinos, we are used to socialization such as getting together, going into parties or celebrations, going to places with friends such as to the cinema or eating alongside with family members in a restaurant. But because of the challenges posed by the COVID-19 pandemic, these activities are now limited. But then again, it would not stop us as individuals being a social being. So we still can be connected to other people through the use of internet, such as through group chat, video calls, Zoom calls, anything that will still connect us to other people and would still have the same intensity of relationship that we used to have with them during our ability to interact with them personally or through face-to-face. Next is stretching or relaxation exercises. So our body's ability to generate nerve impulses, have a good circulation depends on the movement. So it is important for us to find time to really stretch our muscles and our body even by doing simple stretching exercises. So this can be as disciplined as yoga or tai chi, but this can be as simple as usual stretching exercise whenever you are experiencing back pain or even shoulder pain. So stretching and relaxation exercises. Next is smiling or humor. Of course, we all know how funny thoughts can really lighten up our mood. So we are always looking forward to see an individual who is funny, who is throwing jokes and make us laugh, because smiling can really alleviate our tension or our stress. So this is the reason why also we are preferring to watch comedy films or romantic comedy films, or anything that is funny on YouTube or in Facebook or even in TikToks. So smiling or humor is a form of stress management. Stress debriefing. So stress debriefing is a form of stress management that is applicable to individuals who have experienced the same situation, and is usually being processed by a trained personnel or a trained individual in stress debriefing. So it may not be indicated to all individuals, but at least we are aware that there are forms of stress management such as this one that can help us process our thoughts, emotions, and our experiences. Speaking to someone, of course, it is important for us to connect to someone who can really listen to us well, provide us better understanding of the situation, and who can validate our experiences. So speaking to someone is important because it provides us the avenue to voice out our experiences, our thoughts, our emotions, and somehow it provides us the connection to become more aware of our situation. So what is important in looking for someone to speak to is that we need to find someone who can really listen to us by providing his or her time, someone who is empathic, someone who is validating, and someone who is non-judgmental. So if we are looking for these characteristics into an individual, it is also meaningful or important for us that we exude the same characters or the same characteristics if someone would be talking to us. Sounds and sights would include listening to music or listening to the sounds of nature. It may also include watching Netflix or videos or YouTube. It may also include our pastimes such as watching beautiful places, or even going to sceneries, or to the beach or to the mountains, anything that would really relax our mind through the sense of sight and through the sense of hearing. Scheduling. Scheduling is important because it helps us understand and manage our time. So we all know for a fact that we have limited number of hours in a day, and these are should be equally divided, or should have a balance between the work, the life, and the rest time. So in a day, we only have 8 hours for sleeping at most, or at least we have 8 hours of doing task or attending the school or the household chores, and we have 8 hours of doing our personal needs, or spending it with our loved one. So scheduling plays a significant role in reminding us what are the tasks that can be done for a day, and what are the tasks that can be rescheduled because this day is already full, or it is really impossible to finish all of these things at the same time. So scheduling, or putting into perspective the things that we need to do, provides us the ability to at least control, or at least plan ahead of how we will be using our time wisely. Sports are usually contact sports for most of us: basketball, volleyball, and other forms of sport. But because of the COVID-19 pandemic, of course, we are now limited to individual sports such as running, biking, or swimming, or even non-contact sports such as badminton or even tennis. But then again, some may find it hard to do these things because of the restrictions, but we can still have activities like this one, such as Zumba or such as weightlifting, or even jumping or running or doing calisthenics at our own homes. So sports can still be done even in a limited space. And last but not the least are the sensation techniques. So this involves our senses, such as the sense of smell for those individuals who are fond of aromatherapy or scented candles or essential oils. So these suit our senses and provides us some sense of relief. Sensation technique may also include massage, spa, or anything that has something to do with our skin. So this can be relaxing and can bring some inner peace or some light mood into us. And then for those individuals who are adult or married, sensation techniques also include sexual activities. Some of the practical tips or skills that can be done during times that we are facing some struggles or difficult in controlling our thoughts are deep breathing exercise and stop skills. So for the deep breathing exercise, what we need to do is sit in a comfortable position, close our eyes, and breathe in slowly using our nose with our mouth closed, and breathing in, focusing on our breath by counting to 5. So as we feel or we focus ourselves on our breathing, we feel our belly as it is being filled with air. Now slowly breathe out through your mouth in a count of 5, and then repeat the process or the cycle 5 times more or 10 times more or maybe 15 times more until you feel more relaxed. So this is deep breathing exercise. Another skills that can be used at an instant is what we call the stop skills. So the premise of this stop skills is that you are doing something or you are in the middle of finishing a task and then suddenly you become uncomfortable or there are thoughts that have bothered your mind and you cannot focus on the task at hand or the things that you do. So what you can do is to do the stop skills. So one is to stop, or S is to stop by not reacting, stopping or freezing, and not moving a muscle. So during this time, because of what you are experiencing, the inner tension, your emotions may try to make you act without thinking. But you must remain in control or stay in control and do not react or just stop. Letter T is take a step back. So take a step back from the situation by taking a break. If it is better for you to leave your workplace or your workstation, go to a place wherein you think you are safe and comfortable. Go to the lobby, go to the cafeteria, go to the garden, go near the window. So just let go of what you are doing for the moment. If you're comfortable in where you are right now, do the deep breathing exercise. So that's another T. Take a deep breath. Again, your feelings or your thoughts may be as strong as before, but do not let these feelings and thoughts make you act impulsively. So still, stay in control and take a step back. Letter O, observe. So if you are becoming now more relaxed after doing the deep breathing exercise, from taking a step back, you may now want to observe what is going inside and outside your mind and body. You would like to recall what had happened that makes you or that made you feel uncomfortable and uneasy. Maybe recall what is the situation before you have experienced or during the time you're experiencing the discomfort. And then now, after taking a break or taking a step back, describe your feelings and the reaction of your body. So you would like to highlight that now you are more relaxed. Now you can think clearly. Now you can handle your emotions well. And now you are ready to go back to your work. If you are successful in observing what is happening inside and outside your mind and body, then you can go now to letter P, which is proceeding mindfully. So this time, you will act with awareness. You will consider your thoughts, your feelings, the situations, and the other people's thoughts and feelings on what you will do. You will think of your goal. For example, you might want to think that now I will go back to my workplace. My goal is to finish my task, and my goal is not to be distracted by the people around me and focus on the things that I do. My goal is to not be bothered by the negative thoughts and to just continue until the day is over. So this is proceeding mindfully. So all of those steps are comprising these stop skills. S, stop. T, take a step back. O, observe. And P, proceed mindfully. Now, here are some positive self-care tips to avoid crisis. So number 1 is be kind to yourself. So be kind to yourself in a way that identify or be aware of how your body or your mind is reacting to stressful situation. If you are experiencing distress, therefore, you need to be kind to yourself by really taking a break and focusing onto your recovery or focusing on your having an inner peace. So it's impossible for us to be kind to other people if we cannot be kind to ourselves. So kindness always begin in you, and kindness can only be exuded if you are kind to yourself. Second is take personal time and breaks. So it is important for us to have a balance between our work and our personal time. So during this pandemic wherein people might be working at home rather than in the office, it is important for us to have a delineation of time between the work and the personal time. So if your boss or if your coworker or if your superiors would really bother you after 5 o'clock in the afternoon for emails or for tasks, please be kind to yourself by not or by politely declining to do those things and insisting that the work hours is already over. So if we or if you allow these individuals to really take charge of your time, eventually you will see that you will not be able to handle anymore the demands that they are imposing to you. So politely decline by saying that your work time is done and maybe these things can be done the following day. So take personal time and breaks. Third is educate yourself to understand your reactions. So this is similar to self-awareness. Again, it is important for us to identify how we react to stressful situations behaviorally, emotionally, physically, and cognitively. So, if we are aware of our reactions to stressful situation, we are now becoming more in control of the things that we can do to minimize or manage the impact of these stressful situations. Number four is accept where you are in your own journey. So people these days have the tendency to browse the social media and would feel bad after seeing how other people are doing right now in their lives. So we have this tendency to really compare our situation to others. So as mentioned earlier, we might be in the same ocean of pandemic, but we are on a different boat. So just remember that you are the master of or your own destiny, or you are the master of your own journey. So what is more important is that you're working your journey in a progressive way. You're always moving forward, and sometimes it will not matter how fast you are moving forward. What is more significant is that you are working to really attain your goals. So again, it might be futile to compare ourselves to other people because we have different experiences, different resources, different strengths and abilities, and different support system. Number five is know that the people who are close to you may not always be available to help you cope. So during this time of pandemic, everyone is affected. So please do not bear grudges to individuals whom you always run to whenever you have problems, when they are not able to provide you the support that you needed. This is because they might be also affected by the situation, and this time, rather than helping you, maybe they are the ones who are needing help. So please extend your patience and compassion and try to understand everyone's situation. Next is talk things over your feelings and thoughts with people who can validate you. So as mentioned earlier, we need someone who is empathic, someone who can validate or who can validate our thoughts and our emotions, someone who can be non-judgmental, and someone who can be there to really listen to us well and give full attention and focus. Listen to others who have similar experiences. So listening to others and sharing your own experiences might be helpful in a way that it will bring us understanding and learning of how other people have gone through and how they have managed their own situation. So by listening to their experiences, we might be able to pick up some techniques or some skills or some means of how these people have navigated through their problems, which can also be applicable to our situation. So we need to listen and share our own experience because other people might also learn from our circumstances. Be sure to set boundaries in your work and caregiving relationship. So this is explained earlier. And last but not the least is express your needs out loud. So during this time, wherein most of us or most of the time we're wearing masks, it is impossible for us to read the facial expressions of everyone. And sometimes our mask hampers our ability to talk well. So other people would be having difficulty listening to us or hearing our responses. So what is important is that during this difficult time, we need to express our thoughts in a polite situation or in a polite manner so that there would be less misinterpretation, less miscommunication, and more understanding. Now, for those individual who would like to talk to someone else, you can always call the National Center for Mental Health Crisis Hotline. So we have the Luzon-wide landline toll-free number 1553, as well as the other numbers posted in your screen. We have the Globe and DM subscribers number, and the Sun, Smart, and Talk and Text subscribers number. So our crisis hotline is a 24/7 service that is available and is free of charge. So our responders are trained responders. They are not psychiatrists or psychologists, but they are trained in crisis intervention. They may able to provide you the time to talk and listen to what your thoughts are, and can also link you to the services that you would be needing. So similarly, I think Caraga or Region 13 and the other regions also have their own regional crisis hotline. Now, for those individuals who might want to have a consultation with a psychiatrist, I'm taking this opportunity also to promote the recoveryhub.ph. So, contrary to the, or not similar to Crisis Hotline, this one has a professional fee. So this is not free. So this is a consultation platform wherein different psychiatrists can provide you different schedules or time. So you may just want to log in to the recoveryhub.ph and see the schedule that match your time, or even the doctors that you think might be helpful to you. So these are the two available services that can be reached anytime. Now, as my parting slide, I'll be leaving you with the quote from Dalai Lama. So he says, if you have fear of some pain or suffering, you should examine whether there is anything you can do about it. If you can, there's no need to worry about it. If you cannot do anything, then there is also no need to worry. Now, on my part, taking care of our mental health is the smartest thing to do, not only during this COVID-19 pandemic, but all the time, because mental health is an integral part of our well-being. So, maraming salamat po at ingat po tayong lahat. Thank you for your kind attention.
All right, so I'm back again, and that ends the discussion with Doc Rodney Boncajes. But we are still having a question and answer portion where our speaker would be tackling answers to the questions that were sent to us. Most of them actually wala naman tayong nakikita from the comment section, but we have received a few questions from us private messages. So, of course, these questions are still related to our topic, taking care of our mental health during the pandemic. By the way, we'd like to thank our speaker, Dr. Rodney Boncajes, for joining us in today's discussion. It was very meaningful and informative. And of course, we'd like to thank as well the viewers that our live. Maraming salamat po, especially those who are at Surigao del Norte College of Agriculture and Technology, Alviola Integrated School, RHU Talacogo, Tandag CHO. Thank you so much. At this point, we are now going to acknowledge and read the questions that were sent to us. Our first question right here, Doc: how do you think we should approach or solve problems regarding individuals who need psychiatric care in mental hospitals when mental hospitals now are not really accepting admission?
Yes, okay. So good morning to everyone. I hope that I am clear. I'm experiencing some kind of delay or technical problem here in Manila because of the rain. But sige, to answer your question, good morning. How can we address the needs of those individuals with mental health conditions who cannot access now facilities because of the restrictions brought about by COVID-19? Uh, of course, we are adapting to the new normal. So there are still services that are available, not face to face or physically, but we are now shifting into the use of telemental health or online consultation. So there are hospitals who are still providing mental health services, but not the usual outpatient consultation or the face to face, but more of the use of social media platforms or the use of technology through online consultation. Now, for those communities who might be having limited numbers of mental health professionals, maybe you would like to check on to your local municipal health offices, because majority or some of the doctors at the municipal offices, our rural health physicians or our municipal health officers, and even our nurses are trained on MHGAP, which is focusing on providing mental health services for mental health conditions. So you may want to check your RHU or rural health office. Refill of medications and follow-up can be done at the level of the RHU. So I think those are and of course we are promoting the hotline of Caraga, no. So Caraga has their own hotline who may also link us to mental health services that are available in your region. So be it online or be it face to face.
All right. Yes, we do have a DOH Historieta helpline, which we will post later on as we end our discussion. We will be posting the Smart and Globe hotlines. Thank you so much for answering our first question, Doc. I think the second question will be relatable to a lot of mothers. I would say that the affected during this pandemic are the pandemic babies, yung mga toddlers natin, yung mga moms na kakapanganak pa lang. So our question is related to that. What can parents do to assist their offspring's growing curiosity, especially the pandemic babies, to explore and learn when they are only limited to their homes because of this health crisis?
Of course, okay, sige. Of course, we are experiencing this kind of problem, not only the adults, but even the toddlers and even the younger individuals. So everyone is affected with this pandemic. So the
Yes.
WHO and even the DOH has been promoting a, uh, some means of how to interact with our children during this pandemic time. So one is to let them know what is happening by telling them on the level that they can understand, simple languages that they can understand what is going on, what they can do, and what are we doing right now to protect ourselves. So second is, aside from telling them in the language that they can understand the situation, is to ask them from time to time how they feel or what are their thoughts are, so that we will be able to understand what is happening onto their mind. And of course, provide question as direct as we can, so that there would be better understanding on their part. You may also want to engage your children into activities that would also provide interaction with among you and among the family members, so that despite the limitations or the inability to go outside and play, there's still interactions among the family member. Also provide them time to have or promote time that would provide them some opportunity to learn new things or to explore their talents or skills. So these are some of the tips that are being promoted by the WHO as well as by the Department of Health.
Mhm. Thank you, Doc. Follow-up question regarding that. Is there any relative social parang social gap in the growth of our children?
Sorry, naputol lang konti yung question. Can you repeat? Sorry.
Yeah, it's just a follow-up question regarding your answer. We wanted to know how heavy the social gap will be for the children who grew up during the pandemic.
Okay, so that is an interesting question, although that is something that needs to be validated and be a focus of research later on. Of course, we cannot see yet the impact of the pandemic right now because it's still evolving. The situation is still ongoing. So there might be some adjustment, there might be some adaptations, but then again, it's too early to see the impact because we're still on the process of dealing the pandemic. But definitely, there would be some changes, there would be some adaptations. It's the nature of the individual to really adapt to the situation. So let us see. It's too early, but then again, we need to have studies on this so that it would be well documented, it would be evidence based.
All right, Doc. Thank you so much. Now, our last question that we'll be catering for today. I feel that this is common to all. For individuals who feel lost, how do you think should they assess their feelings, and what should an individual do about it?
Okay, I always ask or parang teach or impart this concept to my patient. This is something that I have learned from our mentors in NCMH. So there is this concept: awareness, understanding, and compassion. So how would one assess feelings, and what can an individual do about it? One is to become aware muna of the situation. Ano yung nararamdaman niya or feeling niya. So notice and name. Just notice and name, or identify what is happening to you in your mind and in your body, so that there would be an awareness that there's something that needs to be addressed, or there is something that is changing within you. Second is understand. Understand what are your feelings and your thoughts right now. Why are this being felt or being into your system right now? So understand, look for the reason, look for deeper meaning why it is happening to you, and then maybe understand also by asking some people who can really help you manage or process your thoughts or your emotions. And then by having that understanding of what is happening to you, you will now become more compassionate to yourself. So compassionate in such a way that you would not feel bad because it is not part of being, or it's not a result of a poor personality. It's not a result of a curse or something that is brought about by nature or whatsoever, or by unforeseen or unseen forces. So compassionate in such a way that you would also be able to be kind and extend the same help to those individuals who might be experiencing the same situations as you are. So awareness leading to understanding, and understanding leading to compassion.
All right, thank you so much, Doc. So I think based on what you have answered, identifying and understanding oneself is key. And I think it was also nice that you pointed out that mental health issues are not due to poor personalities. I think it's very comforting for those who are suffering right now. We have a follow up question with regards to the first question that we received earlier. The question is, how do we address violent patients, Doc, for those with limited mental health care?
Okay, how do we address violent patient? Number one, again, awareness, understanding, and being compassionate. So one is look for the reason or identify the reason why the patient is becoming violent. So for some individuals are becoming aggressive because they are responding to the hallucinations or to the voices that are going into their head. For some, they are violent because they feel threatened by how other people act, or by the thoughts that other people would be after them. For some, they are aggressive because some of their needs are not met. So, for example, for those individuals who are really hungry, for those individuals who feel unsecured. So, understand or identify first what is the reason why the patient is reacting in such an aggressive situation or aggressive way. Second is understanding. So since we are now aware what is happening to this individual, we now need to understand what can we do, or what are the things that can really pacify this individual. So rather than exerting force, such as the use of restraints instantaneously, or the use of handcuffs instantaneously, what can we do is to talk down to the patient, or somehow listen first to the patient in a way that would let us learn, or would let us know what is the needs of that patient. So we need to talk down, or what we call de-escalating. So in de-escalation, we're trying to talk down to the patient first before we do some actions that would inadvertently lead to restraint or something like that. So those are the two initial technique. Now, if the individual is really uncooperative and posing a threat to other individuals as well, or to the self of that patient or that individual, there is now the need to use some minimal force quote unquote minimal force that is just to prevent that individual from doing harm. So we can ask other people who are trained in dealing with these individuals, such as our crisis responders, our emergency responders, including our police, the firemen, and even the barangay tanod. So it would be difficult for a healthcare worker to manage these violent patients alone. So we need to first be safe and ask for help of those people who can really help in this kind of situation.
All right. Thank you so much, Doc, for answering the questions. That was really informative. And of course, with regards to calling professional help, we have our this DOH Historieta helpline available 8 a.m. to 5 p.m. on weekdays. Of course, we answer calls on holidays. We have Smart and Globe lines, as you can see on your screen. For Globe, we have 0927-230-4885, and for Smart, 0908-615-8754. Again, ladies and gentlemen, that was Dr. Rodney Boncajes. Thank you so much, Doc, for being with us. And of course, we are going to present to you our certificate of appreciation for joining us in today's discussion. What you have shared with us, Doc, is really important. And of course, again, since we are pushing for a healthy Filipinas, your knowledge today and your expertise in this area is very much appreciated. The Republic of the Philippines Department of Health Center for Health Development Caraga would like to present the certificate of appreciation to Dr. Rodney R. Boncajes for sharing his valuable knowledge during the webinar series on mental health in celebration of the National Mental Health Week on October 13, 2021 at 9 a.m. via Facebook Live, signed by our Regional Director, Cesar Cachon. Thank you so much, Doc, for
Thank
having
you.
a discussion with us, your precious time, for sharing your precious time with us. And of course, thank you so much for our viewers on Facebook. And of course, for
And thank
claiming of the certificates for the participants, we will just flash a banner. You can claim your certificates through the email nmhp.carag@gmail.com. We will address your concerns through this email so you can send us your messages privately. Thank you so much, Doc. And of course, to our friends who are still watching us live, feel free to share our discussion on Facebook on your posts. We can use the hashtag you matter and hashtag mental health for all. Don't worry po, kahit hindi na po live, anyone can replay the discussions just in case your friends, family members are not available at this time to watch our live discussion. They can always review and find this live event. Of course, we are live here at the DOH CHD Caraga Facebook page. And of course, syempre naman, for tomorrow, we are going to have another interesting discussion about building one's well-being while serving others. Generally, this is about caring for our carers. So we hope that you can join us once again for tomorrow's activity. It's very helpful that we become champions for mental health. Again, this is our very special role to play. Hindi pwedeng chosen people lang ang advocates for mental health. We should be all in this together. Of course, we would like to thank the DOH CHD Caraga for initiating this activity. Regional Director Cesar Cachon, Assistant Regional Director Dr. Sadaila Rakiin, and of course, LSH Chief Dr. Ernesto Pareja, MSD Chief Ms. Eileen Sacol, RLED Chief Dr. Glenn Tiangha, Non-Communicable Disease Cluster Head Dr. Agnes Colliantes, Regional Mental Health Coordinator Ms. Rowena Pabia, the Non-Communicable Disease Cluster, and of course the Health Promotion Unit for making this event possible. Thank you so much for watching us today. And of course, tomorrow is our third day of the Mental Health Series Day 3. I hope that you can still join us. It will be a wonderful session. And of course, we hope that you can be more interactive tomorrow, as we're also going to have the same open discussion with our invited speaker. Thank you so much, and I hope you just enjoy the rest of your day.
Pat.
And we're the Yoga Twins.
Yay!
High five, Pat.
High five! Bam!
We are so excited to be here today to talk to you about mental health.
Ang health ay hindi lang about our physical health, pero kasama talaga ang pag-aalaga sa ating mental health also.
Together, Pat and I have been practicing yoga and mental health techniques for over a decade.
Lahat ng mga tips and lessons that we'll be sharing through this month ay para sa lahat.
And today, we get to share some of these super easy, super quick, and very doable exercises with you.
Ang unang naming tip para sa mental health ay kailangan natin lahat ng mahimbing at malalim na tulog gabi-gabi. Bakit? Unang-una, pag natutulog tayo, mga muscles natin ay nakakapagpahinga at nire-repair. Bumababa ang ating presyon ng dugo, which is good, at bumabalik ang energy. Pag natutulog tayo, nawawalan din natin ang stress ng araw at ang anxiety natin. Alam niyo ba na pag natutulog tayo, when we dream, susi ito ng pampalakas ng alaala, ng memory natin at kalagayan ng mood. Pero alam din natin na hindi madali makatulog. Kaya panoorin natin si Dan sa isang munting breathing exercise na pwede natin gawin bago matulog for better sleep.
Salamat, Pat! Sana hindi pa kayo nalilito. Ako naman si Yoga Twin Dan. Isa itong technique na ginagamit ko when I teach yoga to my students. And are we ready? Alright. Kung maaari, maghanap tayo ng isang lugar na tahimik, lugar na malayo-layo sa istorbo, para talagang malagay tayo sa mood at makuha natin ang benefits ng exercise. Walang kailangan para gawin tong exercise except kailangan lang marunong kayong bumilang. Hanggang 4 lang naman. So, kayang-kaya. Alright. Magsisimula na tayo. Follow my voice, follow my instructions. Start with closing your eyes. Settling down. Following me. Inhale for 1, 2, 3, 4. Hold. 4, 3, 2, 1. Exhale. 1, 2, 3, 4. Hold. 4, 3, 2, 1. Inhale. 1, 2, 3, 4. Hold. 4, 3, 2, 1. Inhale. 1, 2, 3, 4. Hold. 4, 3, 2, 1. Open your eyes. Pwede nyo itong ulitin kung gaano karaming beses na kailangan. Pero ito yung isang simpleng exercise that will help us get a deeper, richer, and more meaningful sleep to help with our mental wellness.
Kumusta naman ka karong pandemya higala? Nanginahanglan ka ba og kaistorya? Ayaw ka bala ka? Adunay we support service providers nga andam maminaw kanimo. Abri ang atong linya gikan alas 8 sa buntag hangtod alas 5 sa hapon. Lunes hangtod Biyernes gawas lamang sa holidays. I-text lang ang DSWD space we support space pangalan /kasarian/edad/rehiyon /mensahe or concern o isend kini sa 0918-912-2813 o tawag lamang sa numero nga 0963-569-1906 alang sa Smart 0945-344-9755 alang sa Globe. Pwede usab sa atong website wesupport.dswd.gov.ph o mag-send sa email nga wesupport.focrg@dswd.gov.ph. Makasiguro mo ang tanang impormasyon nga inyong ipaambit ikonsiderang konfidensyal o pribado.
We listen, we care, we support.
DSWD, katuwang ng mga kapuspala.
Nasayod ka ba? Nga bisan sa wala pa mahitabo ang pandemya, aduna nay taas nga kaso sa depresyon ang Pilipinas. Sumala sa World Health Organization, ang depresyon nakaapekto sa kapin sa 3 ka milyon nga mga Pilipinhon. Samtang, ang mga sakit sa pangisip mao ang ikatulong nga labing kaylap nga klase sa sakit sa nasod. Kadaghanan sa mga misulay o paghihikog tungod sa kasubo nga dala sa sosyal o biyolohikal nga mga hinungdan. Apan, ang mga sintomas sa depresyon dili dali makit-an o mahibal-an sa ordinaryong pagtan-aw lamang. Kasagaran, maalaan lamang kini o kaguol o dili bakaha, masaypan nga katapol. Ang kahimtang sa pangisip makaapekto sa abilidad sa paglambo sa usa ka tawo ug daghan pa ang wala masayod tungod niini. Ang kadaghanan wala na ngayog tabang tungod sa kaulaw o kahadlok nga mahukman. Mao nga ang pagpasar sa Mental Health Act sa Pilipinas kaniadtong tuig 2018 way usa ka dakong lakang sa pagtubag sa mga kabalaka kabahin sa kahimsog sa pangisip. Aniya ang mga butang nga kinahanglan nimong mahibalaan may tungod sa Mental Health Act. Ginalangkob niini dili lamang ang kahimsog sa pangisip apan ang kinatibuk ang kahimtang sa usa ka tawo. Kinatinguha niini nga maprotektahan ang mga pasyente gikan sa diskriminasyon ug uban pang mga paglapas sa tawhanong katungod. Kini naglatid sa mga katungod sa usa ka tawo nga nangayo og tabang ingon man ni adtong nagatagana sa pag-atiman sa kahimsog sa paghuna-huna. Nanginahanglan kini og pagbansay aron lapad ang mahatag nga serbisyo alang sa kahimsog sa pangisip nga dali, barato ug makabot. Magmugna kini og pundok nga magsiguro nga masunod ang mga probisyon sa balaod. Kinasiguro niini ang paggahin sa mga pondo. Apan, bisan pa man og hapsay ang pagkahimo sa Mental Health Act nga naa sa papel, sa unsang pamaagi kini mapatuman. Ang matag lokal nga panggamhanan adunay mahinungdanong papel niini. Ang matag unit sa lokal nga panggamhanan kinahanglang magmugna sa ilang kaugalingong programa sa pagtagana o mga serbisyo sa kahimsog sa pangisip ug edukasyon alang sa katilingban. Ug isip mga individual, mahimo usab nato ang atong bahin pinaagi sa pagka mas sensitibo sa mga pagbati sa uban ug dasigon sila nga mangayo og profesional nga tabang nga walay paghukom. Mahimo natong undangon ang suliran ug himuon nga mas malipayon ang kalibutan kung kitang tanan magkahiusa. Kung ikaw o kung naduna kay kaila nga nakasinati og depresyon o uban pa mga problema sa kahimsog sa pangisip, mahimong makontak ang musunod nga mga numero.